Welcome back, everyone. Rising costs and not enough reimbursements for insurance company providers are putting Arkansas hospitals in a big-time squeeze. And at one North Arkansas hospital, it's leading to some layoffs. Arkansas business editor Lance Turner joining us now with more about this. And Lance, we're talking about a realignment plan announced late last week by North Arkansas Regional Medical Center.
Well, that's right. The health system announced late Thursday that it will have to close some clinics, move some services around, and of course, cut about 3% of its workforce. This as the hospital struggles with those rising costs and what it calls inadequate payments from health insurance plans, payments that aren't able to support the hospital's essential services. In a statement, the medical center said that it would have to end services at its inpatient geriatric behavioral health unit called the Center for Memory, Mood, and Thought. It's also going to move all urgent care to the Med Plaza in Harrison, and it will close 2 health clinics, one each in Marshall and another in Lead Hill. In all, about 750 people work at the main hospital in Harrison and also across 18 clinics in North Arkansas.
Yeah, this is something I think a lot of hospitals are dealing with. So what is the hospital's leaders saying about why they're having to do this?
Well, they say they're just like every other hospital in the country, rural hospitals in particular, struggling with rising costs because of inflation. And they're rising at such a rate that these health insurance reimbursements have not been able to keep up. In fact, North Arkansas Regional says that its overall expenses are almost 3 times greater than additional revenue. The health system says that many times the health insurance reimbursements aren't even reimbursing enough to cost the actual cost of providing care, and that means a financial loss for the hospital. In fact, North Arkansas Regional reported an $8.7 million loss in its most recent fiscal year.
That is amazing. All right, so the big question is, when it comes to patients, what are patients going to expect in this kind of environment for hospitals?
Well, in the case of the Harrison Hospital and Health System, it's consolidating services where it can, and it's moving some patient visits to telemedicine. So patients should be prepared for some telemedicine activity, but also some of their services may have moved, perhaps to other locations. Meanwhile, we could expect to see other hospitals in the state consolidate operations, drop services, or even close. And we've also seen hospitals get into some intense negotiations with their health insurance companies over those reimbursement rates. In fact, earlier this year, one of those negotiations led to a hospital being dropped from a provider's network temporarily. So the bottom line is a lot of hard times for hospitals on the horizon.
Wow. All right, Lance, thanks for your time on this, of course. And as always, you can read more about this at arkansasbusiness.com.